All right, so I'm just gonna show you a couple of more, and then I'm gonna, see if I can find pictures about the vertebrae. So on this video, Logan, I'm gonna go through the muscles of the trunk wall, which I believe was in your lab 1 or 2, as well as going to the muscles of respiration. And I think that would be just about it. So let's take a look at the muscles of the external trunk wall. Over here, you can see the external obliques. How do we know these are the external obliques? Because you can still see the rectus sheath. The rectus sheath means that this is a very superficial muscle layer. And the external obliques are the most superficial of those muscle layers that we'll talk about in a second. Pec major, deep to the pec major, pec minor. Now, the pec minor is a muscle for respiration. So I don't know why they didn't have that in your word list, but I guess that's okay. Now, the internal intercostals are down here, and it's usually right closer towards the manubrium. We see the internal intercostals. Now, the externals are coming in from the lateral aspect over here. So in order to see it, we should have to remove the actual pec minor, and now you see the external intercostal muscles coming downwards right here, right? So let's take a look at those. I'm just going to go in a little bit. You can see the external intercostals. They're coming from superior lateral down to the medial inferior aspect. So it comes down on a horizontal like this. Now the inferior or internal intercostals goes from medial superior to lateral, or medial superior to lateral inferior. So it goes like opposite of it. What else do we see? On this example, right, the muscles down here coming from around, these are your anterior serratus muscles. The posterior serratus muscles we'll have to see in the back. Now, what else do we see in terms of the musculature? So we've removed one layer, right? Now we see the rectus muscle, the rectus abdominis muscles really well. And what I'm going to do then, right, this is your internal oblique muscles. And we see that because we see the rectus abdominis muscle, right? So external oblique, we see when you see the rectus sheath. Internal obliques, right? And then as we go even a little deeper, right, the transverse abdominis actually see on the abdominal wall. So I don't think I can see that here. Maybe I can see it on the abdomen a little bit better. Again, external oblique. Now you see the rectus abdominis, and now we can see the internal obliques. This is a much better picture, the internal obliques over here. As we go even deeper, you see the transverse abdominis, right? Thick muscle right here, lots of fascia in the middle right here, the transverse abdominis. Now, right, as we look down a little bit more, I'm going to just kind of go a little bit, right? So I'm going to take a look at the posterior view in the back and take a look at some of the muscles there, right? So in terms of the muscles in the back right here in the trunk wall, right, the latissimus dorsi, the trapezius, in order to see the erector muscles, and as well as seeing the, the erector spinae, as well as seeing the posterior serratus muscles, we need to actually look from the posterior. These are your posterior serratus muscles right here. So take a look at those, right? Posterior serratus muscle, they look like miniature versions of, the latissimus dorsi. This is the posterior serratus superior, posterior serratus inferior. As we look even deeper, right? Now you can see the iliocostalis muscle going to the ribs. Then you see the longissimus muscles. And then you see the spinalis muscles down here. Again, the best way to remember this is a mnemonic. I love spaghetti. I for iliocostalis, all the way up. Love, longissimus, all the way up. Spaghetti for the spinalis, most medial, all the way up. All right, I know it sounds silly, but that's probably, that's a mnemonic I use. It's actually not too bad, right? Again, I love spaghetti. Iliocostalis comes from the ilium all the way up to the ribs, costal. Longissimus comes straight up right here, and it's a very straight muscle. And it's one in the middle. And then the one that's most medial is our spinalis muscle. And this muscle is really thick and tough. So, right. Now, the last thing I want to show you here is the diaphragm. But in order to show that, I'm going to actually need to see that abdomen again and go about as deep as possible. All right, too deep. Nope, doesn't see it yet. Maybe in the thorax. Go a little deeper. Yeah. Let me see if I can find it. Maybe in the digestive system. Right, you can see the diaphragm right up here. The diaphragm then separates your thorax from the abdominal cavity. And we should be able to, right, tell because it does separate those two regions. Right, now I'm going to see again if I can find it. Over here. I don't know if I'll be able to. You can kind of see the outline of the thorax down here. Right? Big dome-shaped muscles separated into two cavities, the thoracic and the abdominal.